if any, in terms of end of life care? You can either type it in the chat. Yeah, unmute and ask. Anyone in this group is familiar with end of life care? I mean, I know that you will be dealing with patients in ICUs and things, but do you practice symptom management or training the family members, preparing the patient, and a little bit of planning ahead? I'd like to hear your experience also.
Maybe I can comment here if nobody does. I do have a fair bit of experience with this as a resident in end-of-life care, when we withdraw care, when we were preparing patients for withdrawal of care, and when we were transferring them to inpatient hospice. So it was, very powerful to hear him talk about those experiences, because I think there's the sound of a patient dying stays with you for the rest of your life. And I think a lot of physicians don't get to experience that these days because, like you said, a lot of them die in the ICU, and it's actually a lot more comfortable for us because the patient just dies. But this can, go on for days. And when I was a very young physician, as an intern, I got to experience this, where a woman in the hospital took a week to die, actively die. It was one of the most difficult experiences. I don't know if that was helpful, but I just wanted to share.
Thank you so much for sharing. I guess whenever I have talked to medical students or postgraduates, I mean, most of them or almost all of them have not seen someone dying naturally, other than dying in an ICU or attempting the resuscitation. They are not familiar with the, as Frank has mentioned, the symptoms of dying, like the death rattle, how important it is to tell the family that the urine output will be reduced, the color of urine will be less, the body temperature changes, even the body odor changes when someone approaches death. So most of the medical students were not familiar with all this.
Sri, can I ask you a question about when my mother was dying a few months before that, I had talked to her about whether she wanted organ donation or body donation. And I mentioned to her that for me, that in my advanced directives and my will, I have things about body donation, about donating my body to my medical school for research. And we were talking to her, and she was very interested in doing that. But and the local medical college did have a program, but it was very, very difficult for us to access it. We didn't know who to call or what to do. Does India have a program where it is, what is the way for patients like my family right now, if they do want to do organ donation or if they want to do body donation, is there a central place for them to call to find out how to do this?
Before answering that from my own very limited experience in organ donation, I would like to hear from any of the faculty members here, because all of them work in medical institutions. So like, are you aware of any procedure by where you can donate your organ donation or body donation? What?
I think you can log in into the Noto portal. There's a Noto portal. You will get
NOTTO, right? NOTTO.
Yeah.
NOTTO?
NOTTO.
Is that something that even patients can access, or is it only for medical professionals?
I think patients can access, because me as a CHS officer, we were given forms to fill, and there was one program. So there most of us filled the forms. But as far as I remember, it was launched a few years ago. That time we were told that even patients and even non-medicals, many of them, they actually went and physically filled the form. But now it is on the Noto portal. If I have not accessed the portal of late, but there is a portal for that.
Thank you, Ruchi.
NOTTO. Yeah.
Thank you. Appreciate it.
You just Google it and then you can get the details of it.
There is
Thank
another portal for Kerala which I have accessed, which is the same NOTTO, it is SOTTO, it is a state organ donation and transplant team. And that is kind of very well used. And I mean, but to be in reality,
Yeah, there is a discrepancy
yes,
in
for
donation also in different parts of India. In some parts, people are more aware and more donations are happening, that's for sure. But in general, this is a centralized one. That must be the state part of the portal. I assume so.
And in the general Indian setting, I am so surprised that Sudha, you could have a conversation with your mom about organ donation. That generally doesn't happen.
Um,
So it's
Actually, I
really
think, my mother and I have had a very different relationship, mainly because of my involvement in palliative care for very long. I've had very open discussions with her about what she wanted after life, the kind of things that Frank was talking about regarding her. In our family, there were some other complications because mom was Christian and the rest of the family was Hindu. So what kind of rights did she want when she was dying, whether she wanted burial or whether she wanted cremation, did she want Hindu ceremonies? These were all conversations that we had. It was extremely difficult for me because these are not done normally in India, but they're very commonplace here in the US because people here buy burial plots when they're my age. We buy burial plots. So this is part of it culturally here. Like I said, I have willed my body to my medical school and I'm in my 50s and it's not considered odd or weird. But yes, but the amazing thing was that mom was, people think that, oh, they'll hate it or they'll be upset, but I think depends on how you bring, as long as you bring that topic with care and compassion and love. She was very open and she's from a very, very conservative, traditional Indian family. And that's how she's lived. And she was still very open-minded to hear and talk about all of this. So I'm very thankful that I was able to have these conversations with her.
I mean, that's one message that I want to convey also. Like we all differ to talk about end of life care. We don't talk about advanced care planning. We just don't use the word death. Whenever we have to have an end of life care conversation, we keep beating around the bush. Oh, things are not really bad as you think. So people don't understand. But once you ask these questions, once you discuss this very well in advance, that probably you will have only a few days to weeks to live, and what kind of care, where do you want to be cared, or what kind of care that who all you want to be with you. I mean, it is our barrier that we don't talk about it. What I have experienced is that the moment you start talking about it, people will come up with a lot of things like, oh, I want to see my brother, I have not talked to him for last 10 years, we had a small fight, can I just have a conversation? So we actually called the brother, and then initially he was very reluctant. Then we told that your brother is dying, probably this will be the last time that you can come and meet, and that forgiveness that Frank was mentioning. So unless as medical professionals we should not be scared to use the word death, because we associate failure with death probably. So using the word death is first thing that you have to practice in your day-to-day thing. And as medical faculties, it becomes very important because the students are going to learn from you. Whatever you teach them from the textbooks, you teach good communication skills, good end of life care in the class. And when you go to the ward, you are not talking about it. Students will take it as this is something that you can learn in the classroom, but not practiced. We are the role models for them. So I hope you'll start taking care of patients who are dying, and symptom management, and whatever we have learned in the last few sessions, so that students automatically learn from you, even if you don't demonstrate any of this in the classroom. Any other comments or questions from other participants in the chat or?
Hi, good evening. My name is Dr. Rajiv.
Yes, Dr.
I'm a pulmonologist. Yeah, I would like to give you some comments. Like, I would like to recall some of the things that happened during my post-graduation days in Bombay. So, for this, regarding this organ donation, we used to have a organ donation team and an organ donation coordinator. So, all we had to do is inform that person, and that person takes care of everything, right from logging into the registry, taking care where the requirement is, and everything. And one more thing that comes to my mind is that usually, there are a lot of fine tuning that is required to maintain that person, to maintain the, electrolyte balance and all the perfusion to the organs and everything. So in a hospice setup, I'm not sure how a person will be able to, help in organ donation. They might need a proper ICU setup so that, the most of the organs are in a well perfused and a viable state. That was one comment I wanted to make. And another comment was that when you talk about this end of care, I remember having one patient, cystic fibrosis, 24-year-old kid. From my first year till my third year, that patient used to get admitted repeatedly, every once in 2 months, 1 month, pseudomonas infection all the time. And his pulse rate, his respiratory rate will be always above 40, pulse rate will be always above 140. And it is true that the trauma that we were able to witness the trauma that the parents went through and everything. And in a way, we residents also actually had that. Like when he passed away during my third year, even most of us were, kind of depressed. And I think even physicians need some help, during these things. Just two comments I wanted to add.
Thank you, Dr. Rajiv. Two very powerful comments. You are right about organ donation in patients in the hospice. Although many of our patients have expressed, this was one challenge that we were facing. And when I had a conversation with the organ donation team, they were telling, they really had an incident where, okay, because my son is donating the organs, he's kept in the ICU, and see the other person, he can meet everyone around him. They can go much earlier, but my son is kept for a little longer for the procedure. Is it because that we decided to donate the organ? So these are the ethical dilemmas that they come across when it comes to organ donation. And some of our patients who had cancer, but they wish to donate organs very strongly, but they could not do that because of the illness that they have. So these are the challenges that we have also faced. Thank you so much for sharing that. And thank you for sharing the incident, that experience that you had with the cystic fibrosis. Definitely, yes, doctors need support. And the basic, I think we are not at all trained to deal with these situations. We are not at all trained to deal with the irreversibility of many illnesses. Talk about it in a very slow manner, taking care of ourselves. Like there is no training for self-care at all in any of the curriculum so far. So I completely agree that we also need some support group and discussions when such patients come to our lives during the practice. Thank you so much for sharing that.
Sri, can I make a comment about the organ donation?
Definitely.
One of the things that is body donation not a thing in India, because then you don't have to worry about organ donation, right? Because then you don't have to keep them alive and have all of this, care at the end of life. Is that not an option? Not an option?
It is an option, but it's like end of life care is not talked. Organ donation, sometimes people do talk about it, but I've never come across someone talking about body donation to a patient in a hospital. It's very rare. I don't know the experience from the other faculty members in this group. Maybe I am not, because maybe I work in a very different setting. That's one reason, but I'm interested to hear from others.
When you mean a body donation, like for our anatomy lab,
Yes,
as a
yes.
cadaver,
Yes,
is that what
or
you're
scientific use? Yes,
I
either for
understand, yeah.
anatomy lab or scientific use, or in forensic use. There are several ways where you can use the body for various things that, even though you don't have viable tissue.
Yeah, this is one aspect. I don't think so. I've never had a discussion with any of the persons. It's usually an organ donation. This whole body donation, yes, it is a very rare thing that we discuss. At least at least that's the experience I've had.
Thank you, Rajiv.
Thank you for sharing that. Any last comments from the participants or any questions? We'll be sharing the PDF of the presentation from Dr. Frank. You can refer to it anytime you want. And there are many other resources, like Rajam mentioned yesterday, the guidelines for blue maple, the position statement, the Supreme Court judgment, which is already shared in the group. So those are all very useful documents. If someone asks you why you're doing end of life care, these are the documents that you can rely upon and share with people. If there are no more questions, we can wind up today's session. Shripriya, would you like to tell about the next session and how it goes?
Yes, I do have a small PP to share. So just